Want to say day 165,243 of the government-posed lockdown. Make no mistake about it, at this point, this is no longer about public health. This is about control. Control and power over the masses, over you, over your family, over your loved ones, over everybody. This stopped being a public health issue when people who actually were practicing the social distancing guidelines, and I do mean guidelines, these measures are not actual laws passed by state legislatures or city councils or a federal Congress. These are emergency measures granted through emergency powers that governors and mayors and all sorts of local and state tyrants, even federal tyrants, are imposing upon themselves. This stopped becoming a public health issue when people who actually were obeying these guidelines were being arrested for going into the park, even though there was no one else around. They were obeying the social distancing guidelines, but they're arrested for being somewhere they weren't supposed to be. You had people that were going surfing on the beach out in the middle of the ocean, no one around within probably hundreds of yards, being arrested for surfing. They were obeying the guidelines. But since you're not allowed out of your apartment, you have to be hunkered down so you can submit to whatever the government tells you, which will probably be a mandatory vaccination campaign. You can't go anywhere. This is more prevalent in more blue, i.e. Democrat-controlled areas, like that cunt governor up in Michigan, Whitmer, who looks like a villain out of a 90s political thriller. It would probably be played by Sigourney Weaver at that time. But you have Phil Murphy in Jersey, Como, Newsom out in California, that racist prick down in Virginia, Northam. All Democrats, all imposing draconian style laws to assert their power and control over people. They're using this emergency as a guise to gain more power. Never let a crisis go to waste, as some statist liberal authoritarians would say. This no longer became about a public health issue when you had when you had doctors being coerced by hospital administrators to inflate the coronavirus death toll. I think this originates from the fact that the CARES Act, which passed on March 27th, gives hospitals a shit ton of money for every COVID-19 patient they have. So you would have a mixture of people coming into there getting this virus, and this virus would spread around the hospital. And you have a routine amount of people who die every day, which I mean by routine people dying, you have people that are dying anyway. People die in nursing homes and hospitals from various illnesses, or dying of old age, cancer, heart disease, aren't surviving putting through operations. You have a routine amount of people are dying, and the places they die in are like hospitals and nursing homes. And some of these people, while they're dying there, contract COVID-19, but are dying anyway. So they're dying with coronavirus, not of coronavirus. Then you have some people that aren't even being tested for it who routinely die, and they're like, it put it down as COVID-19 death. So doctors are actually being coerced by their hospital administrators to mark just about any and every death they can as a COVID-19 death, and this basically inflates the number. Again, if you're looking at true science here, you want to see the actual numbers so you can get actual data. But by inflating the data, you're creating making the crisis worse than what it is, or at least making the crisis seem worse than what it is. And at this point, it's no longer a public health issue, because if it were a public health issue, you want as most objective data as possible. You don't want deflated data where you just underestimate the crisis, but at the same time you don't want to overestimate the crisis and have inflated data. So this no longer became a public health issue when that started. Then you had doctors going on YouTube, actual frontline doctors going on YouTube and speaking out against this, and they were being censored just for questioning the way the data was counted, trying to be objective. They're being censored, and when you have real doctors being censored, this no longer becomes a public health issue, because if there's a public health issue, you want to hear from the frontline doctors directly. But no, the mainstream left-wing media, mainly the left-wing part of the mainstream media, although Fox joins in the tune too. So yes, some right-wing parts of the mainstream media is basically inflating this crisis, and they're putting on experts. By experts, you mean AMA, American Medical Association, which is owned by big pharmaceutical companies, and FDA, which is also owned by the very pharmaceutical industry they're supposed to, pharmaceutical and medical industry they're supposed to regulate, are all basically compromised. And they're putting on AMA and FDA government-approved quacks. These aren't real doctors. These are doctors that they'll basically work for the pharmaceutical and the food and drug agencies that they're supposed to be regulating, and they're basically paid off by these corporations to say whatever the fuck they want them to. If there's a groundbreaking treatment that might, put give some competition to the certain corporations that own the FDA and AMA, well, they're going to pay their approved quacks to come out and smear campaign against it, when they'll come out with subverted scientific studies. So this is no longer a public health issue when they silence the voices of doctors on YouTube, but put self-proclaimed experts like fucking Bill and Melinda Gates on TV. Bill Gates is a goddamn college dropout. I'm more educated than that motherfucker. Okay, yes, he invented Windows and he became a billionaire because of it, but let's be honest. Windows is his area of expertise. Computer software is his area of expertise. And he still couldn't even fucking keep Windows virus free. And now he wants to be the self-appointed vaccine czar of the world. Also, you have people all over the world reporting to the fact that his vaccination campaigns, mainly in India and Africa, those are people on two different continents, by the way. They're not just one isolated group of political faction from a particular country. Like, you would have the liberal faction of the politics in America, or the Trump faction of the politics in America. That's, yes, a big demographic, but a monolithic demographic. These are various people on various continents, all saying the Bill and Melinda Gates' vaccine campaign from their foundation was killing a lot of people and sterilizing a lot of people. But, since those people in those third world countries aren't really connected to the social media, aren't really connected to media, they have really no voice in the matter. So there was just maybe a few people that were able to get Western media attention that spoke out against it. And of course, since Bill Gates, has a bunch of money, power, and influence, his foundation can, get a bunch of media hacks like the Huffington Post and other left-wing medias to, sort of not just whitewash his mass sterilization campaign, but actually reward him for it, because he's giving these people vaccines, he's saving their lives. Oh, he's a goddamn fucking hero. Let's give him a goddamn medal. So though the Western people basically silenced all the critics of the people in these actual countries, not only covered up his wrongdoings and his mass sterilization campaign, but gave him a reward for it, and honored and applause like crazy, and basically and touted him as if because he gave these people vaccines, and spun it in such a way to make it look like he gave these people vaccines and saved their lives. So they basically subverted his mass sterilization campaign in these countries, which he was testing it out on the third world, to make it look, to spin it around and make it look like he saved lives by giving people these vaccines. But anyways, when you have doctors being actual frontline doctors being silenced on YouTube, and Bill Gates being propped up on all these left-wing and mainstream media outlets, it's no longer a public health issue. Because if it were, you would be listening to the doctors, not rich billionaire quacks like Bill Gates. Again, you don't have to be an actual doctor to be a quack. This guy's a fucking quack. Then you also have doctors, and this is what really pisses me off, being silenced and smeared and outright downplayed for treating COVID-19 with various treatments. When you have these treatments and the doctors that are writing about these treatments, both the treatments and the doctors being smeared for treating the virus, it's no longer a public health issue. Because if these doctors are treating the virus with something that appears to be working, scientists all should gather around, look into this, and be like, and all rally around it. The media should be like, "Yay, these doctors are having good results treating this with intravenous vitamin C or the hydroxychloroquine cocktail." They should be applauding them and showing, "Hey, we got perfect results." But no, doctors are being smeared for using hydroxychloroquine cocktail. The doctors, one doctor in Detroit even had his office raided for giving away free intravenous vitamin C to healthcare workers. It wasn't about money. He was giving it away for free. And the media was smearing him for using fucking vitamin C. Just because these AMA, FDA-approved government-approved quacks haven't approved the vitamin C as a treatment, doesn't mean it's not a legitimate treatment. These quacks, these FDA, AMA, government-approved quacks, would rather see people die than to have their lives possibly saved from taking something that they haven't proved yet. That's how self-important and self-justifying these parasites are. And yes, they are quacks, because real doctors would, jump at an opportunity to see results of sick patients getting better. But no, these doctors downplay it because, we might not need a government-approved vaccine. And yes, it stopped becoming a government health issue when a public health issue when when actual treatments of this virus are being downplayed and smeared by the left-wing media and AMA, FDA-approved quacks. You even had this one doctor, Dr. Joseph Merkelis, and I put the link in the description. He was smeared by the USA Today for saying the truth, that he was given vitamin C and vitamin D to COVID-19 patients, and it was working. Well, the USA Today fact-checked them, and I'll briefly tell you how the fact-checking is really subversion and purposely misleading subversion. Basically, what they did was they fact-checked him and said that his claims were wrong. However, they offered no evidence to the contrary. Instead, they basically changed the wording of his claim. His claim, and this is a trick that these fact-checkers like Snopes and FactCheck and PolitiFact and all these left-wing hacks do, is you take something like, I'll give you, like, for example, his claim. His claim was never that this was an approved treatment that everyone was using. It was, doctors have been using it and it's been getting positive results. That was his claim. Well, this USA Today fact-checking subversion method basically took the claim and basically reworded it. They made the claim, instead of making the claim with what he said, that doctors have been using it for positive results, they claimed that they reworded the claim as if the doctor, this is approved treatment. This is approved and standard treatment for COVID-19. He never claimed that. The reason it's not approved and standard treatment for COVID-19 is because the FDA and AMA won't allow it, because it puts ruin their mandatory vaccination campaign, which I see coming, and it will, put their big pharma overlords out, won't make as much money over it. So, of course, it's not approved. But he never said it was approved, so they basically lied and said that he said it was approved, changing the wording of the claim, and then basically set up a straw man, if you will, and then beat their straw man down. They basically lied, changed the wording of the actual claim, and debunked their reworded claim. Another thing they did is they offered no evidence to the contrary. Instead of giving evidence of actual patients not recuperating by taking vitamin C and D, they offered some quack from a website called Quackwatch, which is basically this big pharma's ability to silence any dissenters of the government-approved quacks in the AMA and FDA. And so they use a quote of this paid approved quack from the Quack Watch from 2012. 2012, before the damn virus, years before this virus, and it was a generic quote about vitamin C, and they used this doctor's opinion from 2012, mind you, as an actual fact, which it wasn't, it was in its opinion, as an actual fact and actual evidence against Dr. Markolius' claim that vitamin C and vitamin D was actually treating COVID-19. However, the doctor wasn't even talking about COVID-19, and plus, he didn't even give any facts. He gave an opinion. And so that's an old fact-checking trick. They switch the words of the claim, and then, debunk the reworded claim. And then they offer opinions as facts. Opinion from this, self-appointed expert, or this cherry-picked expert, or that cherry-picked expert as a fact. And they claim it's debunked. It's total bullshit. Anytime you hear a left-wing media hack say that something's been debunked, not only hasn't it been debunked, but it's probably in fact true. So you can never trust anything that they say is debunked, especially if they say it's been debunked right off the back. So this is no longer a public health issue when you have actual treatments of this virus being smeared, downplayed, and outright, overlooked by the left-wing media and AMA, FDA-approved quacks, I should say. This is no longer a public health issue when you have governors and mayors, left-wing mayors all over the country, keeping people locked down on purpose in order to get there and demand their obedience. This is no longer a public health issue. Make no mistake about it, this is about power and control. If this were about public health, they would allow a gradual reopening of businesses. They wouldn't be releasing criminals from jail and throwing business owners for opening their business up. They would they would be stocking up on these treatments, which they are not. If this were a public health issue, they would be stocking. They would be getting as much treatment, much of these intravenous vitamin C and hydroxychloroquine cocktails as they can to prepare the medical staff, which they're not. Instead, they're downplaying it to keep this crisis going on, so we submit to a government-imposed vaccine. So it's about power and control. It's about power and control because if it wasn't, then they'd be stocking up on the treatments. They'd be gradually opening up the businesses. They'd be preparing the medical field. No, instead they keep everything locked down. They tell people to forgo their regular medical treatments that aren't catastrophic. So when these people forgo these treatments, these minor medical issues they have, these things could build up and create a crisis, create bigger medical issues. So you have these people forgoing their medical treatments, while hospitals remain empty, and this whole micromanaged thing by federal, state, and local governments has gone horribly wrong. And now at this point, we're at risk of this prevention measures are becoming worse than the damn disease. A bit better off if they would just let the virus take its course, taking no prevention measures, taking no prevention measures, and the hospitals would be overwhelmed for a few weeks, and a bunch of people would have died, but more people might die anyway since they're foregoing their medical treatments. And when they do open things back up, hospitals are going to be slammed from all the backlog of people foregoing their routine medical treatments. So at this point, this has become worse than the disease. Another link I have in the description is a Zionist bloodthirsty hack by the name of Dr. Alan Dershowitz. He's a constitutional professor. He's a Democrat. He's been recently loved by the Trump wing of the American politics because he was defending Trump and his against the Russiagate conspiracy theory and the other conspiracy involving the Ukraine phone call that the Democrats used for impeachment. And he defended Trump against that bullshit, mainly because Trump virtue signaled the Zionist state of Israel more. This guy is a hack. I hated him for years. I didn't like what he did to an anti-Zionist professor by the name of Finkelstein. He was an anti-Zionist Jewish professor who tried to get tenure at DePaul. University, and Alan Dershowitz, being at Harvard University, used his power and influence over donors to sort of blackmail DePaul into not giving this guy tenure. That's how big of a dipshit he is. Not to mention that Alan Dershowitz was on Jeffrey Epstein's island. It was a documented fact that he was on there fucking underage girls. So he's a fucking pedophile. He's actually Jeffrey Epstein's attorney. So this pedophile Zionist bloodthirsty douchebag came out and said that the forced vaccinations are constitutionally sound. Huh? How could forced vaccinations be constitutionally sound? Again, I put the link in the description. He said, no, you don't have the right to, not wear a mask or open up your business and get people sick. That's no right in the Constitution. First off, the Constitution restricts the powers of the government, not of the people. That's this fallacy there. The question is not whether or not the people have the right to do this, whether or not the government has the right to forcibly rape, and it is rape people with enforced inoculations. It's rape because you're penetrating someone's body against their will. Does the government have the right to rape or forcibly inoculate people? That's the question, and the answer is no. There's no power given to federal government to forcibly rape people in the U.S. Constitution with vaccinations. The other fallacy of this argument is he assumes that all non-vaccinated people are automatically sick and thus will knowingly or unknowingly go and contaminate everyone else who isn't vaccinated. If the vaccinations work, then what do the vaccinated people have to worry about? So they'd only be, infecting other non-vaccinated people who chose not to get it, if that's the case. But he's just mindlessly assuming that everyone who's non-vaccinated is sick, which isn't true. And he's mindless, and that actually strips people's rights of their due process. Instead of innocent until proven guilty, these people are, instead of the medical version of that would be, healthy until proven infected. Well, these people are infected until proven healthy, which is the opposite of innocent until proven guilty, which strips the due process. So this constitutional scholar is absolutely wrong and full of bullshit. But hey, what do you expect from his bloodthirsty Zionist pedophile who actually was not only defended Jeffrey Epstein, but was on his island fucking underage girls? What else could you expect from a bloodthirsty Zionist pedophile quack like Dershowitz? But again, this is no longer a public health issue. This is about power. This is about control. They want to make everyone submit to a government-enforced vaccination. Now, there was 4 possibilities, I think, why they want a mandatory vaccination. One is money. The pharmaceutical company. Okay, yeah, pharmaceutical. The other one is they think the world's overpopulated, and yes, all these climate change alarmists do think the world is overpopulated. That's the thing with the climate change rhetoric. If you look at all the models of the most grave predictions of the climate change alarmist, the number one cause of man-made climate change is overpopulation. Look at all the models. Every single pseudoscientist just comes out that says climate change is 100% man-made, and we have 5 or 10 years before the Earth gets destroyed or something. The number one cause of this is overpopulation. So if there were only, say, 100 million people on the planet, and they were all driving around Hummers, polluting and creating a shit ton of garbage, it still wouldn't be nearly the amount of damage done to the environment as 8 billion people on the planet doing, burning fossil fuels and creating garbage, etc., and destroying, in their mind, destroying the planet. So all the views of this climate change alarm go back to overpopulation, because even the carbon footprint would be is multiplied by the number of people on the planet. So these people think that world is overpopulated, so that they could be looking for a pathway into every single one buddy's body to mass murder them. I used to think that they would use war to depopulate the planet, but a couple problems with that is a lot of times the lost soldiers reproduce before they go to war, and another problem is a war would probably damage the environment more than the routine pollution. Especially a nuclear war. That might end all life on Earth, defeating their, environmentalist Thanos from Infinity War's Captain Planet crusade to save the planet. So, but the quickest way the most environmentally efficient way is to kill all the humans and leave all the other wildlife alone. Now, how would they do that? You would need like a disease to, just that would just kill humans. Now you could. Now the thing is, though, if they wanted to kill everyone, why not just release the disease that's just kills everyone? Well, it's not uncontrollable. It's uncontrollable, but that's why I don't think it's uncontrollable and everything. So I don't think it's a disease. I don't think that they want to. I don't think the disease would be the best way. And in order to infect all of humanity, they would need a pathway into everyone's body. And what better pathway than a mandatory vaccination, where state, local, and nation governments all over the world forced billions of people to get these inoculations? They could put anything they fucking want in them. And that would be probably the most efficient way to depopulate. The other one would be done the same way. It would be a sterilization campaign. They want to it'll be the same way as pets. They look at pets the same way. Ever hear Bob Barker say spay and neuter your pets? Well, they say dogs and cats on the streets. And if you let the population go, let these stray dogs and cats reproduce like crazy, you'll have bunch of cats. They'll cause ruckuses. They'll start eating each other. They'll spread diseases amongst themselves. A lot of them will get sick and die naturally, and more dogs and cats would die just because they're overpopulated. And plus, the ASPCA will come and and euthanize a bunch of dogs and cats, and it will kill a bunch of dogs and cats. But the main thing to do is go take them and spay and neuter them, and then let them die out not before they reproduce. I think that's the way they're looking at this overpopulation. Is it would be, instead of mass murdering people, it would be more humane just to sterilize them all, let them all die out. That's probably the most probable thing. The other possibility is they want to track people, but so you basically have the four possibilities of being tracking people, money, mass sterilization, or mass murdering people. Well, I don't think it's tracking people right off the bat, because the insistence on using people's cell phones to track the infected people of COVID-19 appears as if they only want to track the people that didn't get the vaccination, mainly because they want to know where they are so they can go with guns and force them to get the vaccination. They want to see where these people been so they didn't affect it, who they infected and who they affected, and basically track everyone to cure the disease. But there'd be no reason to do that if they're all vaccinated and these vaccinations work. Plus, the government doesn't want to track mindless idiotic sheep that just submit to their will. They want to track the people that don't listen to them and don't take the poison of the vaccination. So it's not really about that. And I don't think it's not really about mass surveillance, at least not yet. I don't think it's about money either, because the vaccine companies already sold, or Donald Trump apparently pre-ordered 500 million of these vaccinations, which is more than enough in everyone in America. And at that point, if it's about money, they get their money. He buys 500 million vaccinations. They get their money. He takes the vaccination, and at that point, it would be like, oh well, you get, these people they wouldn't, the powers that be wouldn't care because they already got their money. They wouldn't care if people actually take them or not. They'd be like, okay, if you want them, we got them. Come to your nearest doctor at your early convenience. We'll take the vaccination, whatever you can. If you don't want it, fine. We got more than enough for you. But no, they want everyone to take it. They want them to be mandated. If it really was about money, they wouldn't care if these were mandated or not. They just care about selling it. And if the government buys it, okay, it's there. If you want it, it's there. If not, who cares? We got our money. But they do care. So it's not about money, because if it was about money, they wouldn't care if you took it or not. So it comes down to either murdering or sterilization. Well, if they really wanted to murder people, wouldn't they just create a more deadly virus? Yes. It's the fact that they didn't create a more deadly virus in the Wuhan lab shows that these people aren't as bloodthirsty as you think. So they want to treat us, instead of euthanizing, they want to treat us like stray dogs and cats. Instead of killing a bunch of stray dogs and cats, let's just spay and neuter them and then let them free. And that way we won't feel like total mass murdering dipshits murdering these stray dogs and cats or mass murdering these people. Let's just sterilize them to, save the world. That's more humane. So, and plus, it would in order to mass murder people, they would have to. It would have to be something that would kill people within maybe 30 to 60 days. Maybe it might be long term. You never know. But it would take at least maybe 6 months. And this is quick. This is quick to inoculate every single person on the planet. And if they start in the third world, as Bill Gates, the self-appointed vaccine czar, says they should, then, word will get out to people that, and if people start dying after taking these in the third world or in other countries, word will get out within the period of months that, hey, people are dying after taking these. People are dying by the thousands, if not millions, after taking these. Word will get out to the point that even the most pro-vaccine people, or most pro-COVID-19 vaccine people, would refuse to take it because they would know that that's empirical evidence that this vaccine isn't safe. So I don't think it's about mass murdering. I think it's about mass sterilization. That would make the most sense. Because if you sterilize people, it would take months, maybe even years for people to even realize they're sterilized. And on top of that, you have evidence that Bill Gates and the Melinda Gates Foundation have sterilized people and run, sterilization test runs through vaccinations in India and Africa in the past. So again, that would make sense. I think it is a mass sterilization campaign. And I don't think, and make no mistake about when they say that that things aren't getting back to normal until we get a vaccine. That doesn't mean that boom, they found a vaccine. Okay, everything's opening back up. Go get the vaccine at your doctor's office and make your appointment at the earliest convenience, or go get the vaccine on the way to work at some, army supply tent we set up. No, it's Donald Trump himself has even said that he will deploy the military to mass distribute these vaccines, which is scary because it actually plays into an Alex Jones prophecy that we will have martial law under the military and they'll force us to get these things. That is called Operation Warp Speed, and that's very scary. In fact, that's the most fascist Donald Trump has ever sounded, if you ask me. But if they're going to use the military to force people to get this, don't fucking get it. I'm not fucking getting it. I mean, when they say, we have everything's not going to open up till we have the vaccine, that doesn't mean, boom, vaccine discovered, get it, your doctor's office, the next appointment, next regular checkup, or go to one of our, supply tents or, medical supply, or army supply areas, set up a Walmart or your medical facility where they distribute these in the masses at your earliest convenience. And they're like, no, things aren't gonna open up until everyone gets it, which means if there's going to be millions of people that refuse to get it, and they say, well, we can't open it up to these millions of people get it. Vaccines only work when everyone gets it. So you would literally have the people who are locked down in the cities who just want to get back to normal and get the fuck out of their apartments and be free for once, coercing the people who refuse to get them into getting these vaccines so everyone's life can get back to normal. That at that point becomes the government holding everyone hostage until everyone gets it. Because we even use the people who are mindless obedient pig or mindless obedient sheep to the government who would line up to get it, to coerce the people who refuse to get it into getting it. And they'll show up at their houses with maybe tiki torches and pitchforks demanding that you get this vaccine or we ain't going to open up. We want to get back to normal and you're selfish and blah, blah, blah. And your vaccines are safe. And it's not a question if vaccines are safe. It's a question of whether or not this COVID vaccine is safe. There's a difference between vaccines in general and this particular vaccine, which is mandatory. And never in the history of America has a compulsory vaccination campaign been undertaken, which means that there are vaccines to get in school, but never has it been mandated that everyone get a particular vaccine. That is dangerous. So they would basically use everyone who has gotten vaccinated to coerce the people who refuse to get vaccinated, or else everything isn't open up. That's very dangerous. So make no mistake about this is not about public health. This is about power, control, and some coercion and making you submit to the rule of government. And don't stand for it one fucking bit.